Lumbar puncture is contraindicated in conditions like option A, increased intracranial pressure, option B, encephalitis, option C, meningitis, option D, Guillain-Barré syndrome. The answer is option A, increased intracranial pressure. Increased intracranial pressure is contraindication due to risk of brain matter being compressed and pushed toward the spine. Dilatation of pupils occurs in following condition except option A, atropine overdose, option B, morphine overdose, option C, brainstem death, option D, third cranial nerve palsy. The answer is option B, morphine overdose. Symptoms of morphine overdose: a cold or clammy feel to the skin, bluish color in the fingertips and lips, constricted pupils, blurry vision, nausea, vomiting, severe constipation, slow or irregular breathing, slow heartbeat, severe sleepiness, loss of consciousness, coma. Antidote of morphine is naloxone. Bell's palsy is the paralysis of dash nerve. Option A, trigeminal, option B, optic nerve, option C, facial nerve, option D, oculomotor nerve. The answer is option C, facial nerve. Bell's palsy is the disease of the seventh cranial nerve that produces unilateral or bilateral facial weakness or paralysis. Removed body parts should be disposed by option A, autoclaving, option B, shredding, option C, incineration, option D, landfilling. The answer is option C, incineration. Which of the following is not a parameter for Glasgow Coma Scale? Option A, eye opening, option B, pupillary response, option C, verbal response, option D, motor response. The answer is option B, pupillary response. Glasgow Coma Scale is a neurological scale used to reliably measure a person's level of consciousness after a brain injury. Scoring is based on eye, verbal and motor responses. Maximum score is 15 and minimum score is 3. GUESS is an assessment technique to check option A, skin integrity, option B, dysphagia, option C, neurological status, option D, stroke severity. The answer is option B, dysphagia. The gagging swallowing screen or GUESS assesses the severity of aspiration risk and recommends special diet in patients with dysphagia. The gagging swallow screen mainly used in stroke patients. Which of the following involve the injection of radioisotopes into the body? Option A, radiography, option B, PET, option C, CT imaging, option D, MRI. The answer is option B, PET. Positron emission tomography or PET scan detect early sign of cancer, heart disease and brain disorders. An injectable radioactive tracer detect diseased cells. In computed tomography, scan use X-rays. Magnetic resonance imaging scan use magnetic and radio waves. PET scan use a radioactive tracer to show how one organ is functioning in real time. PET scan detect diseased cell in organs and tissue with the help of intravenous injection of a safe amount of radioactive drug. This substance is called radiotracer. Diseased cell in patient's body absorb more radiotracer than healthy cells. The PET scanner detects this radiation and produces images of the affected tissue. Guillain-Barré syndrome is a disease of which of the following? Option A, brain, option B, peripheral nerve, option C, spinal cord, option D, all of the above. The answer is option B, peripheral nerve. Guillain-Barré syndrome is a rapid onset muscle weakness caused by immune system damaging the peripheral nerve system. Plasma expanders are used in option A severe anemia, option B severe trauma, option C pulmonary edema, option D cardiac failure. The answer is option B severe trauma. Plasma volume expanders are fluids given intravenously to increase or retain the volume of fluid in the circulatory system. They are used to treat patients who have suffered from hemorrhage or shock. A woman is treated with lithium during pregnancy. The fetus should be tested for option A neural tube defect, option B urogenital abnormalities, option C cardiac malformations, option D scalp defects. The answer is cardiac malformation.